Welcome to the COVID-19 Compliance Officer course brought to you by OHSS Consulting. Please ensure you have completed the COVID-19 Awareness course as the introduction to COVID-19 for Section 1. In this section, we will discuss the South African regulations on prevention, planning your return, the legislative requirements, COVID-19 management plan, as well as continuous monitoring for you as a COVID-19 compliance officer. In this section, the regulations on prevention of COVID-19 have been taken from the direction issued in terms of Regulation 410 of the regulations made under Section 27(2) of the Disaster Management Act 2002, titled Measures to Address, Prevent, and combat the spread of COVID-19 in certain workplaces in the Republic of South Africa. We will take a look at 15 sections. Section 3, Risk Assessment and Plans. Section 4, the Administrative Measures. Section 5, Social Distancing Measures. Section 6, Symptom Screening, Sanitizing, Disinfectants, and Washing of Hands in Section 7. Section 8, we will look at cloth masks. In Section 9, we will take a look at the measures to take for public access. In Section 10, we will look at the ventilation requirements, as well as the specific PPE requirements in Section 11. We then discuss what small businesses, those with 10 employees or less, must implement in Section 12. Under Section 13, we look at worker obligations. Section 14, the refusal to work due to exposure of COVID-19. In Section 15, we talk about the deductions that are not allowed to be made in terms of COVID-19, as well as Section 16, the monitoring and enforcing directions. And then we will finish off with the sectoral protocols and guidelines in Section 17. In Section 3 of this regulation, we will look at risk assessment and plans. Every employer is required to undertake a risk assessment to give effect to the minimum measures required by these regulations. They also need to take into account the specific circumstances of the workplace and the requirements of the OHSS regulations for hazardous biological agents. From this risk assessment, you will need to develop a continuous monitoring program developed into a COVID-19 compliance plan, outlining the protective measures that need to be in place. This plan must include the operating hours of a company, a list of employees permitted to work from the office or from homes, a list of vulnerable employees, the protocols for minimizing the number of workers at a workplace, the guidelines to get the workplace COVID-19 ready, measures for daily screening, details of the COVID-19 compliance officer, as well as the specific procedures to resolve any issues that may arise, such as the refusal to work due to being exposed to COVID-19. This risk assessment must also be consulted with and communicated to a representative of a trade union, any health and safety committee established in terms of Section 19 of the OHSS Act, as well as ensuring that this plan is available for inspection by an inspector and a person contemplated in subdirection C of these regulations. Section 4 of this regulation helps us to understand the administrative measures to be implemented with our COVID-19 plan. As a COVID-19 compliance officer appointed for your company, take special note of what these administrative measures are so that you can check your COVID-19 management plan and ensure that the correct policies and procedures are in place, as well as these administrative measures. All employers are to take special measures to mitigate risks of those with comorbidities or conditions contemplated in the definitions of vulnerable persons. Employers are to notify employees on how the plan will be carried out. You are also to notify employees who have symptoms associated with COVID-19 not to return to work and must take paid sick leave in terms of Section 22 of the Basic Conditions of Employment Act. All employers must appoint a manager as a COVID-19 compliance officer. Through these administrative measures, you must ensure adherence to these directions and the plan through monitoring and supervision. You are to implement a rotation, staggered work hour, or shift list, or such like methods to reduce the number of persons at work. You also need to take measures to minimize contact between workers at a workplace. For those employers who have 50 or more employees, you must submit a risk assessment to your OHS committee as well as the Department of Labor within 21 days of commencement of this direction. Employers are to provide employees with information that raises awareness in any form or manner by the use of posters or toolbox talks. You are also to provide employees with directions on how to monitor screening, how to report a COVID case. And if an employee has been diagnosed with COVID-19, you need to inform the National Institute for Communicable Diseases in the correct manner. You need to inform the Compensation Commissioner should this be a COVID-related case. You will also need to investigate the mode of exposure and review your risk assessment. You then need to determine the need to temporarily close if needed by use of an incident-based risk assessment. All employers must give administrative support to any contact tracing measures implemented by the Department of Health. Employers with 50 or more employees have to notify the National Institute for Communicable Diseases as well as the National Department of Health on the following: the employee's vulnerability status, the details of screening employees who show symptoms, the details of employees who test positive, the number of employees identified as high risk, as well as the details of post-infection outcomes of those tested positive and the return to work. Please ensure you use the See More online submission portal for employers who have 50 employees or more. All of these employees must be notified of the data that has been issued in terms of the National Institute for Communicable Diseases as well as the National Department of Health, as well as your own company's adherence to the POPI Act, the Protection of Personal Information. Section 5 of these regulations outlines the social distancing measures to be implemented by all employers. You should have a minimum of 1.5 meter social distancing. As a footnote, in some companies, the minimum distance is not reasonably practical. Thus, reduction in the number of employees may need to be in place to mitigate the risk. Where workstations cannot be 1.5 meters apart, then physical barriers must be placed between workstations. All employers are required to supply free of charge any necessary PPE that is outlined in the risk assessment. All employers must also ensure social distancing through supervision by setting up queue arrangements, dividing workforce into shift or staggered breaks and work times. In terms of Section 6 of this regulation, every company must monitor symptoms. When should symptoms be monitored? When reporting for work. You should ensure the screening register has all the symptoms identified and require employees to check for symptoms, including if they suffer with additional items as set out in Section 61A-2 of these regulations. Those would be for fever, body aches, redness of eyes, nausea, vomiting, diarrhea, fatigue, weakness, or tiredness. All employers must require employees to immediately inform them if they experience any symptoms while at work. The company will need to comply with the guidelines of the National Institute for Communicable Diseases if an employee needs to be tested or if a medical surveillance procedure needs to be set up. A question that often arises: what if I am positive? You are not permitted to go to work. If you are at work, you must immediately be isolated and wear a surgical mask until you can be transported to a public health facility for testing. Once you have been tested, you must self-isolate until your results have been returned. You must stay on paid sick leave until you know you are negative, or, if you are positive, stay off until the doctor has cleared you of the virus. Some employees may wonder, when can they return to work if they only had symptoms? Please know that you are only allowed to return to work after a 10-day quarantine period and if you no longer have the symptoms. You are allowed to return to work 10 days after achieving a clinical stability evaluation, as well as if the employer ensures that personal hygiene, the wearing of masks, social distancing, and coughing etiquette is strictly adhered to by the worker. The employer must closely monitor the employee for symptoms on returning to work. The employer must also ensure that the employee wears a surgical mask for 21 days from the date of diagnosis. Employers are also required to assess the exposure level of other employees who may have had contact with a positive employee. If it was a low-risk rating, you may permit the employee to work and ensure they wear a mask and comply with standard precautions. Ensure you monitor the employee's symptoms for 10 days. If the risk assessment was rated as high, the employee should remain in quarantine for 10 days. They should take sick leave for the duration of the quarantine. There should be an adequate supply of hand sanitizer and disinfectant for all employees to use. Employers should promote the washing of hands regularly. Hand sanitizers must have 70% alcohol and be provided for employees while at work or at home if they are working at home. All disinfectants are to be in accordance with the recommendations from the Department of Health. Employers should also ensure that there is sufficient sanitizer for all visitors to their offices. All offices must also be disinfected before work begins, regularly throughout the day, as well as when work finishes. You must ensure that high-touch areas are disinfected and any biometrics are disabled or disinfected regularly. All facilities must be provided for hand washing with clean water and soap, and only paper towels are to be used. The use of fabric towels is prohibited. Section 8 of these regulations outlines the guideline for cloth masks. Always wear a cloth mask when in public areas. Employers are to provide 2 cloth masks to all employees free of charge. It is to be noted that all cloth masks must have adherence to the fabric mask guidelines. If disposable masks are issued, the number of replaceable masks must be determined by the scope of work and the possibility of masks becoming soiled or wet. This should also be noted in your risk assessment. Employers are to ensure all employees are made conversant with the correct use of masks through training, instructions, and information posters. Face masks are the minimum compliance personal protective equipment, and the risk assessment may indicate additional or more adequate PPE to be used for your scope of work. If your company allows access to the public, then you must ensure strict adherence to the measures as set out in Section 9 of these regulations. You will need to determine the square meterage of your company to ensure the 1.5 meter social distancing rule, as well as how many persons may be allowed in at any given time. You may need to place physical barriers at counters or ensure employees have visors or face shields. You must ensure that visitors sign and complete a screening register before entering the workplace. Display notices to ensure visitors know what protocols to adhere to. You must ensure that any visitor or member of the public wear a mask while entering your workplace. You must take steps to ensure a 1.5 meter social distancing. Employers should provide hand sanitizer at entrances and frequently throughout the workplace for all employees as well as members of the public to use. The COVID-19 compliance officer should supervise and check whether these measures are being implemented. To prevent the spread of COVID-19 in your workplace, all employers should ensure adequate measures for ventilation. Whether the use of natural or mechanical means of ventilation, all ventilation must not feed back into open windows. Where practical, you should have extraction units that are fitted with high-efficiency particulate air filters. Ensure filters are regularly cleaned and replaced. All employers should check the website of the National Department of Health as well as the National Institute for Communicable Diseases for any recommended guidelines on specific personal protective equipment to be used. This could be for specific industries or due to the level of lockdown experienced. Perhaps you have been appointed as a COVID-19 compliance officer for a small business, those with 10 employees or less. Please ensure you read and understand Section 12 of these regulations. They outline these basic measurements. Please ensure you have a basic plan for phasing in workers, as well as the arrangement for those who are over the age of 60. Ensure you have a 1.5 meter social distancing rule or physical barriers between workers. Ensure those who show symptoms are not permitted to work, and immediately contact the Provincial Inspectorate for instructions and directions and ensure employees abide by these instructions. Provide or require all employees to wear a cloth covering over their mouth and nose. You must provide hand sanitizer, soap and clean water for hand washing, and adequate disinfectant for cleaning their workstations. Ensure all employees wash their hands and use sanitizer. Ensure workstations are regularly disinfected, and take any other measures as shown in your risk assessment. With a lot of the responsibility falling toward the employer, as well as you being appointed as the COVID-19 compliance officer, what are the employee obligations? In addition to the obligations of the Occupational Health and Safety Act, every employee is obligated to comply with the measures introduced by their employer as required by these regulations. How will you handle an employee who refuses to work due to exposure to COVID-19? Any refusal of work due to a reasonable justification that the work poses a risk of exposure to COVID-19 must be immediately notified to the employer through the OHS representative or directly as well as the reason for the refusal. The employer must then discuss with the occupational health and safety representative, committee, or directly with the employee to resolve the issue. If the matter cannot be resolved, the employer must notify the Department of Labor inspector of the issue within 24 hours. You may not benefit from or offer benefit to an employee for exercising his or her right in terms of this direction. You may not threaten any employee who refuses to work if the reason is justified. No employee may be dismissed, disciplined, prejudiced, or harassed for refusing to work. The employee may seek assistance by referring the matter to the Commission for Conciliation, Mediation, and Arbitration. Section 15 of these regulations explains that no employer may make any deductions from an employee's remuneration or require or permit an employee to make any payment to the employer or to any other person in respect of anything which the employer is obligated to provide or to do in terms of these directives. To the extent that this directive gives effect to the Occupational Health and Safety Act, the government may authorize local authorities to perform certain inspectorate functions. Failure to comply with these directives will result in government exercising powers as listed in Section 30 of the OHSS Act and perform functions as outlined in Section 29 of the OHSS Act. Contravention of these directives constitutes a contravention of an obligation or prohibition as stipulated in Section 38. For the purpose of promoting, monitoring, and enforcing compliance, an inspector may advise employers and employees of their rights and obligations of the directives in accordance with your Basic Conditions of Employment Act, Section 64. In the interest of preventing the spread of COVID-19, government may require industry associations to develop sectoral guidelines for specific health protocols, especially where firms cannot stagger work hours or provide transport to its employees. Government may make these guidelines effective over and above the current directives in consultation with the sector being affected. Let's recap. As a COVID-19 compliance officer, you should know and understand your company's COVID-19 plan, risk assessment, and procedures for handling incidents or any other issues. Employers are required to provide, ensure adherence to, and enforce any measures as required by the directives in an effort to prevent the spread of COVID-19. Employees are obligated to adhere to these and company-specific directives and protocols. As an appointed COVID-19 compliance officer, you are to keep up to date with government guidelines and changes to directives on websites provided. Please see the www.sacoronavirus.co.za for more information. Being a COVID-19 compliance officer means that you must be able to work cooperatively with your employer and employees to ensure adherence to the protocols set out by the directives and address any issue that may arise in the interest of health and safety. Thank you for completing Section 1 of this COVID-19 Compliance Officer course brought to you by OHSS Consulting. Once you have submitted the questionnaire below, please wait for the Section 2 link to be sent to you.